We can start just with introductions and keep to time because you've all been generous with your time to present to us today. Welcome everyone to the Teamwork for Transformational Care Affinity Group meeting this month. For those of you that are new to these meetings, we have a rotational series of presentations based on teamwork between Stanford Healthcare, Lucille Packard Children's Hospital, Stanford Healthcare Tri-Valley, and Stanford Medical Partners. And this month, we have a special opportunity to both demonstrate teamwork among our Stanford Healthcare patient safety team, as well as leverage all of you as people interested in and advocates for teamwork for the rollout of our new safety updates, our safety system updates. So not only for you to learn about it, but we would also really appreciate your helping to publicize it and advance the use and learning on it. So we will ask that you be advocates for teamwork as well. Today we have the pleasure of three colleagues presenting this. An Peterson, patient safety consultant for Stanford Healthcare Tri-Valley. We have Yelena Korpacheva, senior patient safety specialist for Stanford Healthcare, and Danielle Lagana Treat, senior nursing quality consultant at Stanford Medical Partners. So at this time, I will turn this over to them for their presentation.
Thank you so much, Joe, and everyone at the Teamwork Affinity Group for accommodating us today. It is our pleasure to be here today to share a project that we did or we are doing. It's still current, but we are launching this project on June 1st. So wanted to provide some visibility on what this is and to offer a forum where you can ask us questions as well on what is upcoming. So the Event Parameters Project is an enterprise-wide project, and with me today are my patient safety colleagues, Yelena and Danielle. Uh, this is enterprise-wide because the Midas system is a common system that we use in SHC Tri-Valley, and the Stanford Medicine Partners as well. So um, uh, when we started this project and in designing the changes, we have you in mind as well as our patients. So we hope that this proves to be helpful in your work wherever you are in the enterprise. Next slide, please. So the objectives of the project are three things. So we would like to really focus on the importance of causal factors or causation, or otherwise known as answering the question of why did the event happen. So this could be root causes, this could be the reason why the event occurred, or this could just be influences, something in the environment or something in that scenario exists or did not exist that influenced the event, the occurrence of the event. We would like to share with you the methodology that we use in this project, how we came up with a standard list of contributing factors, but we also want to tie that back to our methodology of reviewing our SAFEs or our safety event analysis. And then finally, we will wrap up with, well, what are these changes that I am supposed to see, And so we will share that all with you. And then we will open the floor for any questions or clarifications that you may have for us. All right, so next slide, please. And I'll turn us over to Danielle.
Thank you so much, Anne and everyone. Okay, so we are going to start off with safety events and their underlying causes. So first, we have to take a step back and understand the SAFE reporting system. So maybe you know, maybe you don't, that SAFE stands for Stanford Alerts from Events. Of course, as we're all here today, is an enterprise-wide platform that we all use. to report patient safety events and near miss events. So there's a distinction between patient safety events and near miss events. Patient safety events, they're both unplanned or unintended events. However, with a patient safety event, the issue reached the patient. It caused harm in some way. With a near miss event, it's also an unplanned event, but we were lucky enough to capture it before reaching a patient and doing any harm to a patient. So that is a great distinction. Near misses, of course, are also referred to as close calls or good catches. We love to see those on the patient safety side because that really gives us a hint as to maybe what's happening before, of course, it does any harm. So as I said before, they provide signals of potential weaknesses or process weaknesses specifically, or system issues. Could be updates, it could be changes that we weren't aware of before. Okay, so why does reporting matter? I'm sure it may seem obvious sometimes, but near misses actually occur far more often than adverse events. But they're far less reported. And this kind of makes sense in human terms that if the patient wasn't harmed, why do we report it? Well, we report it because it really does give us, the quality and patient safety team, a hint into the root causes, which for both near misses and patient safety events, the underlying causes have been found to be the same. So near misses and safety events, it's very important why reporting matters. We can identify trends. So, for example, medical errors, of course, including near misses, can contribute to tens of thousands of deaths each year. And this is per the IOM. And of course, I will be a broken record with this. Near misses definitely allows us and other organizations to identify any systemic flaws before they lead to patient harm. And those are our favorites. They really represent a more proactive approach, right, than a reactive. We would ideally love to be proactive in all forms. So we prevent harm not only to our patients, but also potentially our team. So leaning into contributing factors or safe event parameters, right? They will be used concurrently right now. Well, why do we want to know about contributing factors? Well, they really are the underlying helpful focus signals. They help with our key actions or situations or conditions that lead or have led to an event's occurrence, right? So it gives us a clue as to what we should look at and focus on as a team. Why do we care? So, of course, rather than a generalized or immediate causes of an incident, right, we always have to address the incident in the moment. But for long term and seeing trends, correcting only the immediate cause really doesn't help us as a whole, as an organization. It addresses the symptom a lot of times, but not the underlying cause or problem. And that's what we want to do. We want to really approach any safety event, especially trends, with a prevention in mind, right? A proactiveness. So, of course, determining the causal factors with the help of the contributing factors definitely helps us hone in on our actionable items to help prevent any more occurrences. So just a note that adding causal factors or contributing factors, event parameters, really is more about whether a safety event can be prevented or not. It really helps us focus. It's not about blame. And this also aligns with our Just Culture initiatives in the organization as well. So on the safe submitter side, this is where contributing factors are located. So we just wanted to familiarize you, if you weren't familiar with the SAFE report already, that when you go to submit, that contributing factors or event parameters will be located right here. And it's not a required field, but it really does help us hone in and give us a clue on where to look first, right? And it's great because it's coming from on frontline staff usually. So on the safe reporter side, or reviewer, excuse me, side, this is what we see within Midas. So we already have an updated event parameter here, which is the same as contributing factors, just as a reminder, but this is where the safe reviewer would see that field. So we have the submitter and the reviewer end. Okay, so event parameters to contributing factors. We really want to focus on causation and action. I'm really summarizing what we've already discussed so far already. We want to understand why it happened. Why did an event happen? Whether it be an actual event that harmed a patient or a near miss that we were able to stop before preventing harm to a patient. We want to make sure that the event review and analysis is complete, right? We don't want it to lead to inappropriate or weak corrective actions. And this is a way of mediating that. And really, we wanted to create a more simple and standardized version of our contributing factors. We wanted to align, and both Yelena and Anne will go into more detail about the specifics in a little bit. But we really wanted to integrate human systems and align with just culture as well when thinking about these contributing factors. So overall, the benefits of safety reporting and using contributing factors, right? So we can identify underlying causes. I know I'm probably a broken record by now, but it's super important to understand why an event occurred. We want to understand the what, the how, and the why. We wanted to help us identify actionable items. So redesigning our policies, updating our policies and procedures, our processes of care. And this all helps us lead to better quality and patient safety care. So it also helps with risk management, particularly clinical, right? We are all clinicians here. We really want to contribute significantly to revealing any risks. So if we see a pattern, a trend, we want to highlight those, right? And we educate not only our immediate teams, but also share learnings. So it's really helpful to understand the why. Again, continuous quality improvement, that's what we're here for. We are very focused on quality and patient safety here. And again, identifying trends, being able to provide feedback and engage with our leaders to understand what's happening on the ground and the efficacy of our interventions. We love data, so we want to make sure that any intervention or actionable item is actually helping. And of course, when we find a trend, we have an actionable item, maybe we want to update our education to our staff, right? Because when a policy changes, we need to educate our frontline staff as well, whether a policy or process changes. So we want to make sure that new staff are also up to date and educated because maybe they came from a different organization where the processes slightly differ. We want to make sure we're all aligned here across the entities. So now I will leave it to Yelena to go a little bit more into safety event analysis and the project methodology. Yelena.
Thank you so much, Danielle. Right, we can go right ahead into the next slide. And I want to take you a little bit behind the scenes, right? Okay, what happens? Like what happens when the safe report is submitted? Well, we have some taxonomies, frameworks, and evidence-based practice that we utilize when we review safe reports. We have this algorithm right here that you really don't need to know. You don't need to go into it. You don't need to understand it completely. All what we want you to do to know is that there is a science behind it. We ask questions. Well, was there any deviation? Did we create an error? And if there is none, well, then there is we approach the safe event differently. We classify it differently. Well, let's say there is a deviation. We kind of like moved away a little bit from our standard practice, but it didn't reach the patient. So our barriers in the system were strong, and it didn't reach the patient, and that would be our near miss report. When the deviation actually touched the patient. It's actually reached all the way through all of our barriers that are safety events. And there's two types. There are types where we have caused a moderate to severe harm or even death, and that's a serious safety event. Patient safety teams will create an event analysis and improvement work and follow-up. Let's say that the harm was minimal, temporary, or there was no harm, but the deviation still reached the patient, then it's a safety event. And in that case, patient safety team, quality improvement team, local leader will lead the event review. Next slide. So let's walk through that process, right? So first, the submitter sees something that's not quite right. They identify a safety event. Then submitter enters a safe report, and they do select classification, what they think it is. And it's okay to be wrong. There's so many other teams who will go through taxonomy and classify it correctly. But then they also identify the event type and the contributing factors. And it's so important that they do so because they are the witnesses. They are right there in that moment, witnessing that event. They are the best witnesses to tell us what are those contributing factors are. Because after that, it's all assumptions. The safe report, and then the safe report is reviewed by our patient safety team, local leader, and quality teams. Every single safe report that is entered into our safe reporting system will go through 3 to 5 reviews from different teams. What happens after that? All right, so then event follow-up occurs. And oh my goodness, like this is a very simplistic way, right? Like we are just looking at it from the bird's side view. Because why? We don't need to give all the details right now, but we want you to know what happens behind the scenes. So first, the improvement and learning occurs. Then there is also closing of the loop with the submitter and the teams by their local leaders. And then in certain cases that we have discussed before, event analysis will occur. Event analysis terminology differs from enterprise to enterprise, from organization to organization, right? However, it's there is a common methodology to it. So there is rapid event analysis, also known as apparent cause analysis. When we know what happened and we know how to fix that issue, sometimes it is more black and white than gray. Then there is a comprehensive event analysis, also known as root cause analysis, when we need to go deeper, when we need to understand the process, we need to understand the problem, we need to ask why, and we need to maybe even create a fishbone diagram. Then there's also learning teams, and Juliet, who joined like a year ago our organizations here at Stanford Healthcare, brought that one in. So we bring the teams together, interdisciplinary team together. We bring a nurse and a doctor and a leader, and we ask them, what's going on with that process? What's difficult? What's done? What's dangerous? What's different? There's common cause analysis, and there's also debriefs. So how does our project fits in here? So first of all, it fits in right here where the submitter identifies the event type and the contributing factors to it, right? Like it's so important that they are the witnesses who are putting those in for us to review. It also comes in the event analysis. We need to know the contributing factors to understand how to approach the problem. Next slide. So what was the problem then? If we already have the event parameters in Midas, it already exists, why change it? Well, what we have identified that the list was so long, it was really long, and then it was inconsistent, disorganized. Every time a new idea came up, it just was added and added. There was a lot of duplication. It was unclear, missing. Some of them were never used. It limited our ability to identify the true cause and true contributing factors to the events. Next slide. All right. So how did we approach our improvement process? Well, first of all, we reviewed our current state and we identified that there was over 700 event parameters to choose from for our submitters. for exactly the same people who have 1 to 2 minutes to go and pee, we had 700 event parameters to choose from to submit a safe report. Then we analyzed it and we looked at the existing safe event parameter utilization data. And we have identified that some of them were used 8,000 times. If you can click Danielle for me so we can see that it's a very tiny snippet of all of the 700 event parameters, but some of them were used over 8,000 times and some of them were used never. Then we utilized AI systems to help us to identify redundancies and group those in common themes. And then one of the most important things, because we know that AI hallucinates and we know that AI likes to make us feel good instead of giving us information that we actually need, we went through AI data verification. And that was an extensive process that had a lot of steps and details. We don't have to go into details. All right. So we utilize the best practices and our key safety frameworks to organize our contributing factors into the themes and choose the correct contributing factors to move forward with. We utilize SIPS, System Engineering Initiative for Patient Safety, and that framework focuses on how the entire system affects the outcomes. Human factors analysis and classification system, it's why humans make errors. Human performance improvement focuses on understanding how human errors occurs and designing system and behaviors to prevent it from causing harm. How do we create the system? How do we create environment for our teams to make right decision at the right time in the moment? Then Agency for Healthcare Research and Quality, it's a national patient safety standards and tools. And then our Vision PSO is that focuses on standardization of event reporting and learning across hospitals and different organizations. And then the AHR HRO, a High Reliability Organization Framework, creating that focuses on creating ultra-safe organizations through different steps. Then Safety 2 focuses on understanding why things go right and enhancing system resilience to ensure consistent and safe outcomes. Next slide. All right, so we couldn't do it alone. It was only like 6, 7 of us on a team. So we had to ensure that we have the correct stakeholders collaboration. So we achieved that in 3 steps. Our step 1 was stakeholder identification. Our step 2 was user testing. We created a playground in Midas where our stakeholders can go to and give us feedback. And we created assessment and feedback collection. We received overwhelmingly positive feedback from our stakeholders across 3 entities. They have reported that it was easy to use, understandable, and it helps guide actions. And our step 3 was that we ensured that stakeholder leadership is involved and informed as well, and that they do provide final review and approval. All right, and now I'm going to give it into An Peterson, and she will talk about our upcoming changes.
Thank you so much, Danielle and Yelena. So, what are these changes? So, we can't wait to see what you all are talking about. So, finally, we get to see what this standard list we came up with. Next slide, please. So this is the list of, I would say, selection options that's going to be built or that's being built now in the Midas system. So currently, what we have is 700 of different things. So Yelena reviewed with us how the method was used to come up with about 46, less than 50 contributing factors to be included in our standard list. So I say standard because this selection options will be available to safe reviewers, to safe submitters for any type of event that they select. So there are 3 items here that we want to specially call out. One is the psychological safety. We would like insight from safe submitters if psychological safety contributed to an occurrence of an event. And contributing factors could be positive influences, right? It could be something that worked well for the team. It could also be negative influences. So those are gaps or issues or concerns surrounding psychological safety. The second item is AI. So we want to call this out and be available for safe submitters and safe reviewers to select this contributing factor if it applies to the event that you're reviewing or submitting, because AI is just going to continue to be embedded in the fabric of healthcare. Third is outside events or external influences, very important, because if you're familiar with reviewing events, you probably thought, oh, these are really outside influencers, outside factors that we don't have control over, I don't think, for your facility, for your organization. The accountability might rest on external factors or external entities, manufacturers, vendor related. And I'm not saying that we don't have responsibility around that, but just for purposes of discussion today, we want to call that out. If that is a contributing factor, please go ahead and select it. And you will find that these contributing factors are now organized into categories. And you see that on the left side. There's human level, there's patient level, there's team, there's task, tools, and technology, something about work environment, something about leaderships, something about culture just as a whole, policy and procedure, data and information, and external factors. So these are the main categories that we're introducing into the system and that we are providing as selection options for our team members. Again, this list will go live June 1st. This will be available for anyone who will be in the Midas Safe form. The project team is just finalizing some details to the final list, including healthcare equity items. So we will include that hopefully in our go live on June 1st. So please do look out for that. So where are you going to see these changes again? You will, for the safe reviewer, you will see this list of selection options of contributing factors in this table here where the red box is. Currently, if you are currently in the Midas form, you will see that this is still labeled event parameter. Well, that's going away. We want this to be clear as much as possible, that this is a contributing factors section, and I am choosing this option because I believe I observed or I experienced that this factor either positively contributed to this event or negatively influenced the safety of the patient. Next, please. On the side of the safe submitter, this is what they see. If they are safe submitter alone and submitting a safe, this is where they're going to see that list, the standard list of contributing factors. It's going to be called contributing factors. There's a drop-down menu. We encourage them, for first-timers to pull up the whole list and be familiar with what's included in the selection options, and select those that apply to the event that they're reporting about. Again, it could be observed, it could be an actual experience. Next, please. So what is really the impact to us as stakeholders? So you and I are stakeholders, all those in our participants list in the audience are all stakeholders to this. So taking a step back, for both submitters or reviewers, or you are both a designated reviewer and a submitter, because any team member can submit a SAFE, you will see the same list of contributing factors. This will be available to you, whatever view you are, or through your access as a reviewer. It's a shorter, cleaner, and better organized list called contributing factors. There's a difference if you are designated reviewer. If you are a submitter with no reviewer access or role, then all you have to do when you're submitting a SAFE is to select all the contributing factors in the list that apply to the specific event that you are reporting about. Now, if you are a designated reviewer, Once you receive that SAFE, review the list of contributing factors. What are those items that they selected and submitting to you? Review it, validate it. That's no change in the workflow of a SAFE reviewer. That's what we are doing currently. That's what we expect currently. And then proceed with your review. And so if you identify other contributing factors that uh, are pertinent or applicable to the event, select that in the list and add that. Okay, very important. So the review is comprehensive and complete. And then, of course, no trends in recurring issues. Eventually, when we are using this section of the SAFE form consistently, and submitters and reviewers alike are providing their input as to what factors contributed, we will see a good set of data that we can work on at the high level when we can target, a, a bigger scope of improvement instead of just one event, we're approaching it at a one-on-one approach to improve it, when we can collect all this data and see what are those contributing factors that people are submitting all the time or most of the time. Next, please. I know it's a lot of information. I have one slide with busy, and I hope that this is not too busy, but I'm trying to tie this all up together to summarize. On the left side, that is the list. There will be healthcare equity factors or items that will be added here. Hopefully, those will be included at our June 1st implementation. Our project team is finalizing all of that today and the rest of the week. So that is the standard list of contributing factors that either submitter or the reviewer have access to and should include as part of their process of submitting a SAFE or reviewing a SAFE report. So select all that apply to the event. Now, what is the importance of that to the overall patient safety world, right? So the science of safety goes back to the very basic concept of in the workplace, there are factors there that we work with. Could be alongside of us, something that we expect, or it could be unexpected that leads us to do some workaround. Okay, so whatever is in the environment will impact the creation of a standard workflow or a deference to a workaround. Okay. Now that process, the decision and the step that we take will eventually lead to an outcome. It's like the decisions you make have consequences, but in the patient safety, it could be positive and negative, but we want the positives. So that process eventually will lead to an outcome. Well, that outcome that we're talking about is the patient safety outcome. It's the quality of care outcome for these patients. That is the outcome of the decisions and the environment and the work system and the processes and steps that we took. That created that outcome, whatever it was. The other outcome would be the outcome and impact to us as team members of the facility or for the organization, and then also an outcome for the organization as a whole. So the lesson is that, well, if this produces an outcome, we want to take a look at what are the ingredients of this work system. What's in our environment? What are those factors that are influencing my outcome? I want to know them so that I can work on an action plan that addresses those factors. Okay, because not all factors are going to be the same factors for every type of event. Next, please. After all of that, if you have to take away something, this is it, I think. And this is why we're here. This is what we love. This is where our passion is. This is where our mission and vision is. Are the people, are the patients, are the team members we work with or we work for. And so what do we really need to do? We need to speak up for safety. Safety first, that's a priority. We need to speak up for safety. We need to turn those insights, which are your SAFE reports, into action. If you're leaders, if you're in the role and you have that responsibility, you have that capability, let's turn all those insights into action for patient safety, for our safety. Submit a safe. That's the system, that's a platform, the structure that we have currently and that we offer to everyone. But hopefully that we are successful in providing a safe space for us to submit a safe, to speak up, to review, and to close the loop with all those that we interact with. And I personally would like to thank the members of the project team. Some of them are here, presenters. TJ is here as well, our analyst who's done a great ton for this project, and as well as others, members of the project team. Would like to thank them. And I think at this point, we would love to hear what your questions are, if we can clarify anything. We ask, because there's just a few of us here, we ask for those attendees to please cascade this to your team members and share the updates that are coming. And most importantly, encourage them to do it. Start a conversation, contributing factors. And please reach out to me, Yelena, or Danielle for the facility if you have any questions at all or need support. But I'll turn us over to the bigger group for questions.
Thank you so much, Danielle, Yelena. Really important. I love that you touched on the point. I had jotted it down, and then you answered it that a lot of times we won't do that because we say we don't have time. And anytime you can take 8,000 things and make it into less than 50, that's got to be a great satisfier. And I do want to turn it to the group for questions, but before I do, Ryan, if I may ask, how long does it take to get this recording up? Because I think to An's point, it is really important that this get cascaded, and leaders especially should be able to watch this recording and be able to talk to their staff.
So I was just putting it in chat, so good timing. I should have this as soon as I receive it. I'll post it to our YouTube channel, which will automatically update our website. So if you go to the Teamwork website on smci.stanford.edu, probably by this afternoon it should be there. So have that tab or have that link and then send that out. This recording will be the very first thing you see. Well, you'll scroll down, you'll see the video there, and it will be on our YouTube channel indefinitely. So you'll be able to access it. Also, just if I might, since I've got the floor, I would love to be able to plug the Lean Healthcare Academic Conference. Abstracts are open. So something like this might be a good thing to present at the conference. It's a wonderful conference with improvers from all over the world. So please, also, you can access that from smci.stanford.edu. Look under events. There's the Lean Healthcare Academic Conference, and abstract link is there. So anyway, just wanted to put that plug in as well.
Thank you, Ryan. And we've already had one question from Michelle, which is a great idea. Can this be advertised on the landing page of the intranet? I don't know.
What intranet?
It's information, and I think we'll get so many more people wanting to submit if they know there's quite a few less options to choose from. And people, I don't know, getting information out there via email doesn't fit everyone. So I was just trying to think of where else people could see that this is happening.
We do have a plan of a communication plan for this project. This forum is one of the parts of that. We are advertising through shared leaderships within our organizations. We're advertising it with unit educators, patient safety directors, and more. I think that's a great idea. We will have to utilize our connections to get to the right place. We do have an OPL that will be distributed as well. And we do post it within our SharePoints So yeah, that's a great suggestion. Thank you so much. We'll discuss that with our leadership.
We can never over communicate this, right?
Right, that's true. An adult has to hear information 3 times before they can absorb it, right?
Thank
Suki
you,
can
Yelena.
confirm she's the NPDS. Suki, go
And
ahead.
looks like she has a question.
Thank you so much. This is a great presentation. Really appreciate all of the very great information and sharing this. And so I completely agree with Ryan that this needs to be shared and out there more. And in response to, I love Michelle's note there because I think what happens is that we have a lot that we're working on here at Tri Valley, and it just sort of doesn't come to the top. So maybe at the Tri Valley space also, that would be really nice to have it on our intranet because it is a separate. I totally hear you with the SharePoint. It's been a bit of a struggle to kind of pull that to our staff here at Tri Valley, just getting them on the intranet. So I would love to have maybe some space on there, and I can work with you, Anne, on that if you'd like to kind of make sure that our staff are seeing it here a little more and publicizing it at PGC as well, because I think that's the poster presentations, all those things we've just had recently would be a great space, Ryan. So looking forward to more collaboration there.
Great.
Thank you so much, Suki. Yes, I think you and I have made plans to present to professional governance, I think, in the next coming 2 weeks. And yes, definitely it's part of our plan to include the materials for teaching and education on our intranet. I think one detail we just need to agree on is where actually in the intranet we should put it for easier access. So thank you, and definitely happy to accept the offer to support us. Thank you.
Thanks again. We are at time, so one last thank you to Danielle, Yelena, and An for all this hard work. Looking forward to seeing more submissions because of this, and look forward to seeing everyone in July. And have a great rest of your day.
Thank you, everyone. Bye.
Bye.